Good afternoon, ladies and gentlemen. So I'll be the program director for this session. I see we've already reached the end of the program, Keynote 5. We do have two speakers, Dr. Jabu Mtsweni and Mr. Ashwell Jenneker. I'll just go and introduce both speakers before we go to the topic itself. Dr. Jabu Mtsweni is the head of the Information and Cybersecurity Center at the CSIR and technical leader of National Policy Data Observatory, NPDO in South Africa. His research interests are in digital security, digital information, digital science, cybersecurity, and cybercrimes. And Mr. Ashwell Jenneker is the Deputy Director General for Statistics, South Africa. He is responsible for statistical operations and provincial coordination at Stats SA. The topic today, they'll be talking about the value of high performance computing for decision making in the National Policy Data Observatory during the COVID-19 pandemic. Ladies and gentlemen, before we put in the presentation, who's speaking here is Dora Tobe, the technical manager for the Center for High Performance Computing. And I just want to remind the delegates that we're running the cloud naming competition. If you can go to the lobby and start putting in the entries before the end of the day. Thank you. Dr. Mtsweni, the stage is yours.
Thank you very much, Dora. Thanks, Jabu. Let's go to the first slide. Okay, so I will be dealing with the context and background, and then Jabu will deal with the rest of the presentation, which includes talking about the National Policy Data Observatory, why high performance computing, looking at future considerations and development, summary and recommendations. Thanks, Jabu. Okay, so 2 years ago, we were hit by a pandemic and we all were in a state of panic. And the question that we asked ourselves, how do we make decisions at the time when things are so unreal for us? I mean, even this, having a conference like this is totally unusual. And so we decided the best way to go about it is to empower ourselves with knowledge. And so in order to empower ourselves with knowledge, do we need to put the best data together so that we can make sure that the policymakers make accurate and reliable decisions based on the data that's available. So we started the National Policy Data Observatory, and the idea was to share the information with all that's available, and that all people who needs to know the information at the right time to make decisions. Next slide, Jabu. And so the rubric that we were looking at when we considered what should go into the National Data Observatory was, on the one hand, we looked at how do we manage the virus, because we realized that we would need to coexist with the virus. And so on the one hand, we had the health matrix that will tell us how to manage the virus. But on the other hand, and so that involved possibly introducing lockdowns. But the other hand, you don't want to lock down to the extent where people die of poverty and hunger. So the questions that you had with the socio-economic matrix is, how do you look at the economy and people's living conditions insofar you can then introduce stimulus packages, or either economic or social stimulus packages, to make sure that when you need to introduce lockdowns, when the virus becomes too much, you need to sustain the people living conditions. Let's move on. So let's go more into these health and socio-economic matrices. Next slide, Jabu. Okay, so first we want to look at the health matrix. Just press again. And in terms of the health matrix, we want to make sure that we provide the data that's needed to make health types of decisions. And this is what we call the health data ecosystem. So firstly, we've got sort of case data that will show you what is the progress of the pandemic. And then also the question of what sort of capacity exists. I mean, do we have capacity in terms of oxygen? Do we have capacity in terms of space in hospitals or burial grounds for that matter? And then there was the question of how are we doing in terms of vulnerability? I mean, where would the poorest of the poor stay? Where would the people stay that's more vulnerable to the pandemic? And so we looked at vulnerability indices and also the data that support that sort of thing. And then should you consider lockdown, the question is, what sort of movements have you got, taking into account cell phone tower movement data, and to track whether people is moving or staying at the same place, because we found there's a direct relationship with how the virus is spreading based on how people are moving throughout the country. And then the question of quarantine or isolation management, and here we're using cell phone data to just see whether there's movement in areas, and should you have stricter quarantining or isolation when there's more movement, when there should not be movement. Thanks, Jabu. Let's move to the next one. Just press it one more time so what were we looking at in terms of the socioeconomic imperatives? So what does our socioeconomic data ecosystem look like? And this would provide us insight into the socioeconomic conditions of people, and then you will match that up with the health matrices to see what decisions we need to make. Next slide, please. Okay, so let's look at the socioeconomic data ecosystem. So the first question that we sort of asked ourselves, not necessarily in any specific order, but we know that poverty and inequality is the biggest problems that we've got in South Africa. So the question is, where are the poor staying, and where's the most vulnerable, and what sort of food shortages, for example, would one have that could lead to potential social disorder? I mean, in June and July of this year, we saw in KwaZulu-Natal and in Gauteng what sort of social disorder can break out if you are not keeping proper track of where the poor is, and you're putting enough stimulus in place to make sure that people don't move to the place where you've got social disorder. Then we've got about 12.4 million children, 13 million children at school. And the question is, how do you open schools up so that children are not at risk of this virus? And you look at all the sort of technology that goes with being at school. Can you afford to go online? Which people would have access to online? And so you need to make sure that your decisions doesn't marginalize more. And so you've got all that education sector data available that will give you guidance there. Should you decide to close the economy, the question is, what is the economic setup in South Africa? Where do you need to create jobs? What sort of stimulus packages do you need to put in place? And so what we've decided to do with the National Policy Development Observatory is to put all this data into one place so that people could look at data sets relative to each other to make important decisions. And this is the socioeconomic data ecosystem. Next slide, Jabu. I think this is all from my side. Thank you very much. Jabu, let me hand over to you now.
Thank you. Thank you very much, Ashwell, and for that background. And I think you have given some good context of where we come from and how the National Policy Data Observatory was conceptualized, and also I will touch briefly now on how does the Center, for example, for High Performance Computing comes into play, and why it is valuable into the work that we do, particularly when we are dealing with a lot of data. As you could see, Ashwell did indicate that we are dealing not just with just the statistics about health, but we are dealing with also the social side, we are dealing with the economic side. So basically the National Policy Data Observatory deals with both. So I will first just share with you what the National Policy Data Observatory does at a high level, especially for now, and then tell you why the high performance computing is so important into the work that we are doing. So the National Policy Data Observatory is a government-led initiative supported by the Department of Science and Innovation. And this Policy Data Observatory is currently incubated or hosted at the CSIR. And at the CSIR, that's where the Data and Decision Support Center is at, which is obviously a science facility. And to date, we have continuously make contributions to various structures of government, such as your National Intelligence Operations Structure in the joints. We work very closely on the vaccination now with the Interministerial Committee through DPME, Department of Planning, Monitoring and Evaluation, as well as Government Communication and Information Systems. And I will share a little bit about that. But when we look at what the National Policy Data Observatory is doing currently, there are a number of capabilities and we continuously grow them. If I have time, I would show the demo, but maybe that's not important. I will show it probably if we have time before the end. And currently, we do a lot of data insights, a collection of this data through other data sources such as the NICD, the National Department of Health, and of course, including other data sources from the provinces, data sources from other countries as well, because we are not only just looking into the pandemic internally, but we're also looking at it externally. And we monitor the pandemic, its changes and the variants, as we would have noticed. We also do some projections as well and focused on various indicators, for example, hotspots. We work with the vulnerability index to understand where the vulnerable areas are at, and so on and so forth. But we also, in line with government interventions, such as the district development model, we look at the demographic households data, working very closely with Stats SA, and that's where Ashwell is at. Looking at service delivery issues, for example, where people have water, electricity, the financial status of municipalities, and various other data sources, including social data, working with various anchor institutions such as your HSRC, your SAPREN, in order to understand the impact of COVID, in the social lives of South Africans. But we also work with mobile network operators in terms of understanding the mobility patterns across the country at different levels, so that we can understand the effectiveness of the restrictions that are put in by government, but also to use it to understand possible super spreaders and to see the effectiveness of these restrictions. Recently, we are working very closely with the Interministerial Committee through the workstream number 4 on research, oversight, and monitoring, where we are monitoring the vaccine rollout so that we can understand where the bottlenecks are at and advise, based on data analytics modeling of where we need to improve, and so on and so forth. So as you can see, including the issues of social sentiments, working on social media, understanding the issues of misinformation, and the global trends and development indicators, as I've indicated, for example, the Sustainable Development Goals. We are tracking that through working very closely with DPME. And of course, there are other research, that are done by other institutions where we collect the data as well, such as your people who are doing the research on hesitancy, vaccine hesitancy. So we also do that. We also link directly to other data sources, for example, in Treasury. And then some of the work, the contributions I've already spoken about, but active contributions that are happening on a regular basis, particularly in supporting net joints, NCCC. We are contributing weekly data analytics and reports and supporting the Department of Health, because we generally provide a secondary analysis eye, technical data advisory, what the trends are doing, and I will share a little bit of that now. And we collaborate with other streams in NetJoin, such as your law enforcement, threat and risk assessment, and others as well, including the public health containment unit as well. And we do a lot of tracking in terms of the resurgence, so that we know where is it going or where it might end up and stuff like that. The issues of vaccination I've spoken about, as well as understanding the correlation between the vaccination and vaccination demand and some case data. We'll share a little bit on that. But on the social side, we work very closely with GCIS, Department of Communication and Digital Technologies, where we also look at issues such as your misinformation, data collection and sharing, coming up with strategies on how those misinformation could be kept. And we are also looking at understanding the effectiveness of communication campaigns of government and various other matters. So the NPDO, as you can see, is quite broad, and that is why the CHPC, or high performance computing, was very critical, because the data that we use, it's not just data that I can just run it on my computer, or we can just run it on one server. We rely very heavily on the resources that are provided by CHPC, because there's quite a number of calculations that needs to happen, but we also store a lot of data. And we also realize early on, the issues of scalability and performance are very critical. So when we look at why do we actually need high performance computing to date, since 2020 in the pandemic, we have collected, and close to almost 500,000 or so, 500,000 data records. And this is just regarding COVID-19 and vaccination. And some of the data records I don't count, for example, from other countries, the work we do on modeling, which sometimes takes out a lot of processing power. But we have a number of records. If you combine all of those, it's over 1 million records that we're dealing with. And on a daily basis, some of this data, we want to process all of it at once, because we want to understand the trends. Like now, we want to compare what happened in the previous year at this time and now. So you can't just deal with one record, so you need to deal with multiple records. The other important aspect of why performance computing is so valuable is the issue of automated data collection, because there's a lot of data, and with COVID, data is released every day. Sometimes to have a manual person collecting this, it takes a lot of effort. So we also have some scripts that are scraping the data from various sources, and high performance computing and other resources that we have, they come in very handy. Obviously, when you have to run models and you have to do some projections, or when you have to, for example, visualize this huge amount of data, HCHPC becomes very, very valuable. The issue of diverse data analytics, because we get a number of requests from government and from other various structures on a regular basis. So it becomes very critical for us to be able to respond to these different demands. For example, when there was social unrest, we had to use some of the processing power from the CHPC in order to quickly understand or use some of the data to analyze it, to quickly understand where the social unrest at scale and something like that, using various data sources, for example, Stats SA, the data from COVID, the data from vaccination, because we also have to understand what is the impact of that and so on and so forth. And then as well as
Yeah, it seems like, yes. Yeah, I think it's coming back.
I'm not sure what happened there, but I hope you can still see the screen. Must they
Yes,
still
Jabu,
share?
here again.
Okay, my apologies. I don't know what happened there. So I was on the slide about the CHPC. Let me just see if I can go back to the slide in terms of why it is so valuable, particularly from the element of performance and scalability. And then when we go to the next slide is the issue of some of the artifacts that we are hosting currently within the CHPC environment. And you know, our dashboard of the platform, some of it which is not publicly accessible, but some publicly accessible. So we are hosting all these data sources that I was talking about, and it's the COVID data, it's the vaccination data, some of the stats SA data we are hosting there, the research data from other entities, some financial data from municipalities, and most of this data is public data. The mobility data, we are also hosting it within the CHPC environment, and some of it is pulled automatically, you know, from various sources. And then through this platform, you know, we have visualization where somebody could drill through various indicators where you can also see or understand, you know, migration patterns over a period of time, understand the impact of COVID in various areas. And now we are dealing with vaccinations. We can look at the vaccination program as well as see, you know, where most people are getting vaccinated. And then, of course, you know, this platform, it could also include many other data sources, some of them which we have not added yet, but it's quite a privilege for us to be able to host this, because as I indicated earlier, with us just working with our computers, it was going to be impossible to be able to consume all of this data, including some of the data such as the data for district development model. We've got data from education centers and various others. So indeed, there is quite a number of these activities that we are dealing with and we are hosting in the SHPC. I will show the demo, but maybe just because of time, I will skip it, and then maybe when we have time, I will show it after this. And I think what we are seeing in terms of now the artifacts which I've shown, but now I want to just share with you some of the current artifacts that we have, because some of them are talking about the things that are happening now. So you will have a better idea of what is happening in this specific environment. And for example, you know, talking about the current resurgence, we have, this is just for the data that was done yesterday, where we are looking at how the Omicron that has come in is impacting on the cases. You can clearly see, for example, in Gauteng, at national level, rather, there's about almost 250% increase in cases on the 7-day average, which we use to actually monitor the progress of the pandemic. We are seeing the increases are very high. Looking at the positivity rate, you are almost seeing, in other words, the tests that are coming out positive, almost 16%, which is very, very high. Normally, WHO will indicate that this needs to be below 5%. So once it's at 16.5%, you know, we are seeing that this thing is going to grow some more. Luckily, the number of deaths are still very low, but they are also slightly increasing. Hospitalization is also increasing in Gauteng by at least 50%, almost 50%, with the city of Johannesburg having the highest number of reported cases yesterday. So this is made possible, and some of these may look very simple, but because there's a lot of data that we deal with on a daily basis, and some of our processes are already automated, it becomes easier to pull these statistics within a go. So we can easily, for example, now just show the trends, you know, between 2020 at the same time and what we are seeing happening now. We can even juxtapose this with some levels of restriction level at the same time last year and see when the restrictions were able to change and stuff like that. And this is done on a regular basis by a team of researchers at the CSIR. collaborating with other entities. And then, of course, we are able to provide such inputs to net joints where they can monitor at a provincial level, but we can also go down and monitor the district level, and particularly in Gauteng and other provinces. We can see, for example, here in the city of Johannesburg, in the city of Mtsweni, this is where the problem areas are at. So there's a number of some of these analytics that are being done. This is more just looking at some mobility data, including the cases, merging the two. And this is where, for example, CHPC come in handy, because here we are comparing, a lot of data from 2020 and 2021, and we are able to do this within a short space of time, because we can run our algorithms within the environment without much issues. Where we can clearly see this dark one, which is in 2021 now. We can see that the cases are changing much faster than what we have seen, for example, in the previous year. The previous year is more sort of this one. And we can see that the cases, even though they were increasing around this time, but they were not as rapid as what we are seeing with Omicron. This is a good indication, for example, of the nature of Omicron, how infectious it might be, and how maybe careful we need to be in actually containing it. We are also showing that the movements have increased in certain areas, and so on and so forth. So there's quite a number of these artifacts that we do. And we also get data from other sources, such as the South African Modeling Consortium, where they do a lot of work, in terms of tracking the resurgence and analysis. We rely on their data to also understand other things, such as the hotspots in various districts. For example, we can clearly see where are the hotspots in Gauteng, like the city of Johannesburg, city of Mtsweni, and then the West Rand. As you can see, these have been tracked over a period of time. And as I've indicated, if you have to do this, you can't just do it on your computer or just Excel. It requires a lot of processing power, and it requires a lot of algorithms that needs to be written. We also follow on the vaccination. If you look at this, we track on a daily basis, including where we are with our vaccination. Interestingly, what we are seeing, for example, this week, we are seeing an increase in the number of cases, but we are also seeing an increase in the demand of vaccination. And in the past few weeks, this had been dropping. So if you check, so we see that now people are seemingly, when they see the cases going up, they go and get vaccination, which is a good thing. But probably it's a little bit late, because we really need to up this and stuff like that. So definitely, indeed, we are seeing this thing going up. But what is interesting, we see the adult population that is being vaccinated. There's about 37% that are fully vaccinated, with the coverage of almost 44% in South Africa. Almost 25 million doses have been administered, and all the line records of these administered doses, we are tracking them on a daily basis, including the dropout rates, who are the people who are coming and not coming. So as you can see, there's a lot of analysis, there's a lot of data that is being analyzed on a daily basis, including when you look at this one, where it shows you, for example, in terms of the 18 plus, how many of them are vaccinated in terms of the coverage, which provinces are doing good, which ones are lagging behind. And you can clearly see, for example, the ones with the green going up, such as your Free State, the Eastern Cape is still doing good. The Limpopo and the Western Cape, they are sort of ahead. When you look, for example, at Gauteng, which is a serious problem because that's where the pandemic is at, they are a bit behind. For example, when you look at the 18 plus, we are still below 40%, including those who are fully vaccinated, they are still at 30%. But when you look at other provinces, they are almost at 40%, which is, if Gauteng pulls, at least the situation will be much better. But those are just some of the information we provide even to the decision makers through these analysis, so that they could make some decisions. And we also track some of the vaccination rates per age cohort at different levels, which ones are lagging behind, so that, for example, if the 60 plus are lagging, the decision makers are able to come up with strategies, to pull them forward. And then we also do some elementary forecasting and projections, particularly in terms of giving decision makers to say where we are we going, and how far is it going to take us to get there. For example, we are seeing that by the end of December, we will be having about 50% coverage, which is short of our target of 70%. And we are only seeing that by May, that's when we'll probably have a 70% coverage. And then this is very, very critical, particularly, if we want to contain this particular pandemic. And these are just some of those artifacts that are there. And I think I did speak about this already. What do we see, when the cases are growing up, and what do people do? As you can see, this looks like a crocodile that is opening its mouth. But what we see here is the indication that in as much as the vaccinations immediately in the election season, they were going down, the demand. But now we are seeing that an uptick is still not that much, but we are clearly seeing that the cases, they have an influence on this. So we are really, doing this analysis in various ways, because as they say, with data, you can see many things. And I think now I'm going to probably cover one of the few slides, and I know we still have a lot of time. Maybe I will get the chance to probably show the demo, but the program director will guide me. If you look, we collaborate with other entities. For example, we do some work on this particular screen with GCIS in terms of them understanding some of their campaigns on social media with regards to how effective are they, when are these campaigns effective? Maybe is it during weekends? Looking at negative sentiments, how are people responding to them, to these specific campaigns? Who are the people who are driving these campaigns and stuff like that on social media, in the news and stuff like that. So we are able to even provide data that could, change the strategies of government in how they communicate about the pandemic, about vaccination, and these various campaigns such as Yovuma, weekends and stuff like that. Today, for example, we work very closely because Ridwan, many of you may know him most of the time in the media. He's part of the Data Observatory, and then we get some requests even from our world in data, because we also use a lot of their data to understand the global context in terms of how we can share data with them. And our world in data, they provide data all over the world about all the countries. And that's where the National Policy Data Observatory aims to be, one day, so that we can have a full understanding of our socio-economic issues in South Africa through data. And when we share these data with them, it becomes, an acknowledgement that some of the work that we do has a huge impact, because now the global community could understand much better what is happening in our country, including the issues of hospitalization. They could understand whether the travel bans, are warranted or not, and things like those. Because when we make data available, different decisions could be taken, and that could impact, people's jobs, that could impact people's lives, and communities and nations' economies and stuff like that. So it clearly shows that the work that is done in the National Policy Observatory is very, 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 very key. And then I think we have the last slide, which is the concluding one, but the chair may guide me if maybe I wanted to show the demo just of the platform, if maybe that is, if we still have time, but if not, we will conclude. Chair, do we still have time? Can I?
We still have time.
Okay, thank you. Let me just then maybe just stop to share a little bit, and I'm going to show just the demo so that people could have an appreciation on some of the work that is being done in the Policy Observatory, particularly the work that is hosted at CHPC, because ultimately, that's the focus of this presentation, is to say how does the CHPC enable the work that we do. And as I'm opening it, I'm just going to share. I'm going to share it very quickly. Let me just in a second. Okay. I know sometimes to do things live, the idea. Okay, I will. What's this? Okay, Good. Okay. I hope you can see the screen.
No, not yet, Jabu.
Not yet. Okay. I hope you can see it.
Now I can see it. Thank you.
Yeah. So this is the platform that is hosted at the CHPC, and there's quite a lot of these data sources that we host here, and there's a number of these indicators. So as you can see here on top, COVID-19 is one of the core things, the issues of demographics, for example. There's quite a lot of data sources that we use, like this one is from State SA. But just to give you an indication, you know, when you look at the State SA data, you could see a lot of information about various things. For example, these might show you key statistics, how the population is growing, you know, which gender ratio is growing and stuff like that. But you could also see other things, you know, if you wanted to see from 2002, what has been happening, which provinces are growing more. You could even maybe zoom in into KwaZulu-Natal if you wanted into, and you can see various patterns in KwaZulu-Natal, how the population has been growing in that community. But you could also, if maybe you wanted to go back, if you wanted to see what was happening in 2002, you can see, for example, the Eastern Cape, KwaZulu-Natal and Gauteng, and probably the Western Cape, they're big populated. But if you want, let's say, maybe to move to 2020 or to even, let's say, 2019, you can see how the population dynamics have changed. For example, Eastern Cape might have had a lot of people going maybe away from there, coming to Gauteng or to other provinces and stuff like that. You can also see various other things, such as the age groups, you know, across the various provinces, and so on and so forth. And there could be issues of service delivery, which I will deal with it later. But when it comes to, for example, the issues of movement, you know, the movement data, we are able to see various things, how people are moving from one province to or one district to another, and we can look at this at various levels.
I think we lost
go right.
Dr. Mtsweni again.
Oh, okay. Let me just do this. Just a second. But can you still see the screen?
Yeah,
I think,
yes, I can see the screen.
Okay. Yeah, cool. Yes. So as you can see, we can even see where people are moving from, and within a particular district, we can see how much travel or distance people are moving from one area to another. You know, you could go and look, for example, in Gauteng, and see the movement patterns there. As you can see, there's a lot of movement in Pretoria to Johannesburg, including in Ekurhuleni. You can clearly see that. And then you can see, for example, when people are moving far, what happens in those particular things. And when it comes to COVID, of course, this I'm not going to talk too much about, but you can also see the issues of vaccination at these various levels, whether they're vaccinated with J&J, how many are not vaccinated, and stuff like that. And let me just think the call, that's the one that is troubling me here. That is why I'll call them back. And then including the issues of hospitalization, we are dealing with that, issues of hospitalization. So we can see how many people are in ICU, how many are not in ICU. And some of this data you could also maybe see over the last month. You know, you could see what has happened in the last month, and so on and so forth. So there's quite a number of these. We also have collated research, you know, that has been done by different entities that we work with. So for example, if somebody wanted to know how people are coping with food insecurity, you can find that, including the issues of socioeconomic indicators. So as you can see, there's quite a lot that is happening within the data observatory and through the performance computing. And all of this, you know, is live and is generally what's the word? Maybe let's say the last 30 days, you can clearly see some of the analysis out of there. And as I said, all of this depends on the data that is made available. So we clearly appreciate the efforts of CHPC and for all the work that has been done, and we really appreciate it. And then I think I will just share the last slide so that we conclude. Let me just go to that, and then I will share again. Just give me a second, and then we will conclude. So this is the last slide, and I think Ashwell will also have something to say about it. Generally, as you will have noted, the data is playing a critical role towards differential risk management and data analytics for decision making, particularly in terms of ability to meet the health needs. We clearly saw with this COVID that public and private sector cooperation, particularly on data sharing, the infrastructure that is provided by CHPC is very, very important. And then, of course, the issue of transparency. As we have this data, the public engages with it, and it tends to appreciate much more better. And then, Ashwell, let me give to you to then maybe wrap it up. Thank you, colleagues. Much appreciated.
Thank you, Jabu. I mean, it's truly inspiring the way our plans initially came together to give you all these dashboards that can inform decision makers. I mean, what I presented was our ideas around data ecosystems and what we really want. But what Jabu showed you is what's really there. And I mean, it's amazing the kind of data sets that we've got. The value now lies in the use of this data. So please contact Jabu so that you make sure that you use the data that's there, and the data and the dashboards that's publicly available, and also contribute your own data sets. I mean, if you've got data that you want to contribute that you believe will feed into the national good, because it's now more than just COVID. I mean, initially it was about COVID and responding to the pandemic, but we've got many other challenges in South Africa, like poverty, inequality, unemployment, and issues like that. And so your data sets could potentially shed some light on many of the other issues that we've got. So please be in contact and make sure that you add your data sets to what is already there. Thank you very much, Dora. That's all from my side.
Thank you. Before we can conclude, I think we have one question. I'll just go through that question. It says many of the data are lacking indicators on infection, etc. What is a very dynamic system? How is this taken into account? And are more leading indicators like wastewater testing given greater weight in modeling? That's the question.
Yeah, I just missed it. If you could just read it again. I think I missed the first part.
Many of the data are lagging indicators on infection, etc. What is a very dynamic system? How is this taken into account? And are more leading indicators like wastewater testing given greater weight in modeling?
Oh, okay. I think I understand now. So I think, data could be used for various things. And I think with like wastewater testing, which a number of colleagues are doing it, from various institutions, and we've had some engagements with them, and we rely as well on their data, to understand particularly the emergence of resurgence, because wastewater testing can tell you infections even before the actual test results. And I think within the data observatory, we embrace all these data points, because we believe that there's not one data source that can give you the whole story. You need these multiple data sources. That is why, as Ashwell was presenting, he spoke about the social aspect of the data. We speak about the technical data. We speak about the health data, but also, the economic data, and sometimes the anecdotal data that is collected through surveys. Because, for example, if one needed to understand the infections, the daily reported data alone is just a snapshot. We use other access data, because there are people who might not necessarily go and attend maybe do a test and stuff like that. And because of that, you might want to look at other indicators to understand infections in a much better way. Thank you. Ashwell, I don't know whether you want to take a...
Thanks, Jabu. I had no idea what that question was about. Thanks for answering that.
Thanks, Dr. Mtsweni and Ashwell. I don't see any other questions beside this one. So, according to the program, this was the last keynote. So if there are no further questions, I don't know if we need to wait for, I think this is supposed to be 45 minutes, which maybe there'll be more questions coming. Okay, so
I would like to just take the opportunity, not a question, but to thank the colleagues for the sterling work and very interesting presentation from your side. I think what we're looking at is to look at this, that how will this requirements scale up as we go in terms of the data requirements, and as part of the planning on the cyber infrastructure, what the demands will be. So this should be some of the things that we have to keep in mind in terms of the forecasting on this. But I think the other important thing is also, and I'm talking here to the converted, to thinking always about how secure is this data. So I know the colleagues all the time, they are thinking about those things. So thank you very much and very good presentation. Thank you.
yes,
Thank you,
indeed,
Happy.
it was a good one. And thank you for the good work that we do, not only for the CSIR, but for the whole country. Thank you.
Thank you very much.
Thank you, Dora.